Hello everyone, I am Nur Erina Yasmin and my metric number is 422-300-3161. And for today, I will explain about the background of carpal tunnel syndrome. Carpal tunnel syndrome can be defined as an opening in your wrist that is formed by the carpal bones on the bottom of the wrist and the transverse carpal ligament across the top of the wrist. Carpal tunnel syndrome happens when the median nerve is compressed as it passes through the carpal tunnel. The median nerve provides sensory and motor function to the thumb and three middle fingers. The carpal tunnel includes the median nerves and 9 flexor tendons, which are 4 tendons from the flexor digitorum profundus, 4 tendons from the flexor digitorum superficialis, and 1 tendon from the flexor pollicis longus. It can lead to numbness, tingling, weakness, or muscle damage on the hand and fingers. Other than that, the pain also can radiate up the affected arm that can be into the upper extremity, shoulder, and neck. According to the orthopedic clinicals Malaysia, the diagnosis of the syndrome will be made through physical examination, symptoms, and investigation. For example, electrophysiological tests such as nerve conduction studies (NCS) and electromyogram (EMG) can be used to evaluate if there is too much pressure on median nerve. X-ray is for image of dense structure like bones. Ultrasound is to help create an image of bone and tissue, while MRI is to scan detailed images of the soft tissue. If the carpal tunnel is left untreated for a long time, it can worsen and cause dysfunction of the hand, including loss of sensation in the fingers. Therefore, there are 2 types of treatment that can be chosen, which are surgical and non-surgical treatment. Non-surgical treatment are wearing a wrist splint, avoid or minimize activities such as using steroid and hand exercises. Next, the surgical treatment options are open carpal tunnel release surgery, which a small incision is made in the wrist and the transverse carpal ligament is cut to ease the pressure on the median nerve, and endoscopic carpal tunnel release surgery, which the surgeon will make a small incision in the wrist and insert an endoscope, which a camera is attached to a narrow tube to view the inside of your wrist. Lastly, there is no specific method that can be prevented from carpal tunnel syndrome. However, you can minimize the risk by having frequent breaks, maintaining good posture, and ensuring that the computer mouse does not strain your wrist. That is all from me. Thank you.
Hi, my name is Nur Iwani, and I will continue with 3 reasons or possible causes contributed to the hazard danger in the case article that can give adverse effect to workers. So a common condition known as a carpal tunnel syndrome (CTS) is caused by pressure or stretching of the median nerve at the wrist pass from the forearm into the hand. These factors include the hand and wrist tumor. A tumor is defined as any usual growth or extension on the hand or wrist. A tumor does not always indicate that it is cancerous or malignant. The majority of hand and wrist tumors are in fact benign, not malignant. Tumors can arise in a variety of forms due to the wide variety of tissue types present in the hand, including skin, fat, ligament, tendon, nerve, blood vessel, bone, and so on. Second is hand and wrist position. Repeatedly using the hand and wrist is a flex or awkward position, such when using a computer keyboard for an extended period of time with the wrist position incorrectly can put additional strain on the median nerve. Second factor is pregnancy. Change in hormone can cause swelling and fluid retention, which can put more strain on the median nerve and raise the risk of carpal tunnel syndrome. There are various reasons why carpal tunnel syndrome can become more likely during pregnancy. Fluid retention means that the body holds on the extra fluid during pregnancy, which can cause edema or swelling in the number of body. Area including the hand and wrist. Carpal tunnel syndrome symptoms may result from pressure on the median nerve as it travels through the carpal tunnel caused by this swelling. Hormonal fluctuation. During pregnancy, there is increased production of progesterone and estrogen, which can have an impact on the ligament surrounding the carpal tunnel and other connective tissue. Lastly, medical condition. A number of illnesses may cause the change of the carpal tunnel syndrome, including diabetes, rheumatoid arthritis, thyroid issue, and obesity. Inflammation and edema brought on by this disorder may compress the median nerve in the carpal tunnel. Arthritis comes in several varieties. Overuse of trauma are the causes of several types of arthritis, such as arthritis rheumatoid differ. Inflammation within the joint is the causes of rheumatoid arthritis. The smooth lining of joining called cartilage is destroyed by this inflammation. The bone shows through when the cartilage degrades. This joint becomes uncomfortable and stiff because bones do not move or bond easily. Swelling can also be brought on by rheumatoid arthritis inflammation. Ligaments are the tissue that keep bones together and are stretched by swelling.
Next, I will explain about the possible effects to human health, physical, and ergonomic hazard. The possible effect of carpal tunnel syndrome towards human health is the irritation in your wrist can be permanent damage. This will happen if the healthcare provider does not diagnose and treat the carpal tunnel as soon as possible. The extra pressure can damage your median nerve that makes it hard to move or use your hand. Other than that, the irreversible injury to the median nerve caused by carpal tunnel syndrome may result in long-term impairment and disability. Reduced dexterity may result from atrophy and weakening of the muscle at the base of the thumb. Individuals with this illness may also experience persistent discomfort in their hands and wrists, which could lead to the development of complicated regional pain syndrome. The development of a neuroma in the pluma, cutaneous branch of the median nerve, is the most common consequence following carpal tunnel surgery. In addition, patients may develop dysesthesia, hypertrophic scars, joint stiffness, and insufficient symptom relief. Next, carpal tunnel syndrome occurs when the median nerve in the wrist is compressed. Experts speculate that a mix of genetic predisposition, particular medical disorder, and environmental variable collectively contribute to the genesis of carpal tunnel syndrome, even if the precise cause of nerve compression is yet unknown. These symptoms may show up in both hands or just one, and they may even go up to the arm. As a result, people with carpal tunnel syndrome may feel clumsy and find it difficult to perform simple tasks like twisting knobs and buttoning garments. Compared to men, women are more likely to experience carpal tunnel syndrome. Moreover, workers in professions requiring repetitive hand motion or the operation of vibrating machinery are especially susceptible to carpal tunnel syndrome. For example, pregnancy, rheumatoid arthritis, diabetes, obesity, hypothyroid, and other conditions could increase the chance of getting carpal tunnel syndrome. Therefore, medical experts need to assist patients set appropriate goals for their course of therapy and inform them of the advantages, disadvantages, and effectiveness of the various carpal tunnel syndrome treatment options. In order to support patients in regaining normal function, integrated therapy, patient education, and prompt treatment are made possible by effective communication between members of the healthcare team. So that is all from me. Thank you.
Hello and Assalamualaikum. My name is Noain Ala binti Rizwan and I will talk about the level of the risk of carpal tunnel syndromes. To show the level of the risk usually affected by the woman more than men. Women are disproportionately affected by carpal tunnel syndrome compared to males, and pregnancy is a major contributing factor. And the article states that 4% of individuals in the general population suffer from carpal tunnel syndrome. Symptoms are believed to be 31 until 62% more common among pregnant women, according to his colleague Dr. Maria Shilling Wong. Furthermore, every expectant mother's blood volume doubles throughout the pregnancy. Consequently, the extra fluid apply more pressure, which cause the blood vessel all over the body to enlarge. This swelling may compress the median nerve in the small place like wrist, which may lead to carpal tunnel syndrome. Following childbirth, symptoms usually go away as blood vessel pressure is reduced and fluid level return to normal. Nonetheless, if a pregnant woman has excruciating hand sensation, she should see a physician. Seeking a medical advice gives mothers peace of mind through their pregnancy journey by facilitating a better understanding and assessment of carpal tunnel syndromes. Next, the level of the risk in carpal tunnel syndrome is usually affected when repetitive activities, such as using a computer keyboard and mouse, scrolling through phone screens, or even cleaning the house can suddenly lead to health concern. Yet frequently go about our regular life without giving the perspective. Moreover, compression of the median nerve, which is found in carpal tunnel, the small space that connect the forearm to the palm of the hand, result in the conditions, which can strike people of any age. Prolonged discomfort, numbness, and tingling sensation are common symptoms, as is weakness in the grip over items. The majority of the time, repeated motion from handheld job are set it off. Carpal tunnel syndrome can also caused by the other factors including hormonal and metabolic change, joints and bone disease, and blood sugar fluctuations, according to Dr. Raymond Ye, a consultant orthopedic trauma and sports surgeon for the medical center in Sunway Velocity, Kuala Lumpur. For example, tightening the protective shield surrounding several tendons in the carpal tunnel of the wrist due to inflammatory arthritis might compress the median nerve. Lastly, the level of the risk in carpal tunnel syndrome can also trigger finger to a person. The medical term for this condition, tenosynovitis of the flanker tendons, describe how it feels like a stuck digit or digits are painful and tight. Other than that, one characterizes it as an unpleasant clicking and catching sensation that occur as a finger open and close. One of its causes is repetitive hand movement, including gripping, twisting, squeezing, and other strong acts among its primary cause. It can occur as a result of the medical disorder like diabetes and rheumatoid arthritis, as well as a basic tasks like knitting, sewing, hand washing garments. Pregnant women are more susceptible to swelling and full rotation, which is similar to carpal tunnel syndromes. Additionally, trigger finger is frequently in youngsters but more common in the elderly. Thank you.
Hi, my name is Caroline Shrip and I will talk about suggestion to control measure. Firstly, we have implement economic improvement. Employer can significantly reduce carpal tunnel syndrome symptom by incorporating ergonomic measure at the workplace. Secondly, ergonomic workstation arrangement. An essential aspect of combating CTS is ergonomic intervention, which includes rearrange workstation that provide ergonomic tools. Employers should supply ergonomic tools such as mouse and keyboard tray to maintain ideal wrist alignment. And Now I will talk about highlight one control measure with strong justification to minimize the effect and ergonomic hazard. Firstly, beyond workstation adjustment. Ergonomic improvement can extend beyond workstation adjustment. Secondly, invest ergonomic tools. So employer can invest a business fund in ergonomic tools such as scissors, soft grip tools, and cushion keyboard pads. Lastly, benefit of ergonomic workplace. Research consistently shows that a more ergonomic workplace not only minimizes the risk of musculoskeletal injuries, but also provide optimal comfort, boost productivity, and improve overall well-being. Next, I will give to Iwani to talk about conclusion. Thank you.
So we will continue about conclusion and act, which act regulation or the section that cover the specific hazard that you have to choose to relate with the above issue. Carpal tunnel syndrome, symptom and treatment. Numbness, tingling, weakness or discomfort in the hand, wrist and finger, especially the thumb, index and middle fingers, are common symptoms of carpal tunnel syndrome. OSHA role in Occupational Health and Safety. United States OSHA is in charge of overseeing occupational health and safety in the country. A general duty clause, Section 5A1 of the Occupational Safety and Health Act. Reporting and compensation for carpal tunnel syndrome. Carpal tunnel syndrome is a reportable occupational illness according to OSHA, recorded on the log of occupational injuries and illness.